you have to learn how to do an assessment or an intervention to the best of your ability without getting anything back from the other person. And as a psychologist, that's quite an unusual situation to be in, because our core training is in clinical psychology, which is all about conversation. It's all about interviewing. It's all about interaction. You know, we're taught an awful lot about reading process, you know, looking at the reaction you get from the other person, you know, thinking about, you know, how you use that as part of your questioning. So, you know, there's an awful lot of our skill set is about that interaction. What stands us in good stead is that, of course, we have a lot of training as well in thinking about behaviour and how to understand behaviour and how to look objectively at behaviour and be careful about interpretation. So I think what we're quite good at as clinical psychologists is thinking about, well, you know, if I'm seeing a movement or if I'm seeing something, what are the possible meanings of it? So we don't necessarily jump to the idea of, oh, the eyes have moved there, that must mean she's looking out the window. You know, and we do see that sometimes, I think, in, you know, other colleagues. I'm not suggesting it's a discipline-specific thing by any means, but as human beings, we're used to that sort of interpretation. You know, most of the time, you know, if we look to somewhere or if we make a gesture somewhere, it's because there's an intent. And I think, as I say, as psychologists, I think we're quite good at trying to bring that objectivity and think about what am I really seeing and how can I test out what I'm seeing? You know, how can I change the environment or change what I'm doing in some way to see whether that changes this behaviour or whether it remains the same? And that will give me some idea then as to, is it responsive or is it reflexive?
So carrying out an assessment, are you a part of any, do you do formal assessments in your role and contribute to kind of, do you fill in forms and give scores?
See, this is a really interesting question. So the service does. You know, as a service, the team will always be doing some level of formal assessment. Will it be a clinical psychologist doing that assessment? Often not, actually. And, you know, just thinking in terms of resources and team working and so on, it doesn't always make sense for us to be the people doing, you know, sort of lengthy assessments, you know, such as the SMART assessment or CRS assessment, for example. What we might do, and often do if patients are having a coma recovery scale assessment, is we might go along to one or two sessions and observe somebody else do it so that we get a flavour of what is this patient doing. We will sometimes do a WIM assessment because of it being, you know, very quick and simple. It's more common that we would get involved at a cognitive level if patients seem to be doing a little bit more, or if there's debate or disagreement within the team about what they can do. And then we would be more likely to take a more bespoke, you know, sort of behavioural experiment type approach, where we would be looking at what people have already seen and where those disagreements are coming from, and then, you know, really sort of tailoring a bespoke way of looking at that with the person. The other times that we would get involved more commonly, I think, as clinical psychologists, is if there is any evidence of, you know, sort of some strong emotion-related responses, you know, sort of tears, sobs, laughing, just to see whether that's contingent on what's going on, or if it seems to be just totally internally generated. And we will also get involved if there is any behaviour that's challenging to manage. So I'm not, with these sorts of patients, that's not usually intentional, but you can have, you know, kind of roaming hands, for example, which are knocking into trackies, you know, fiddling with everything around, and it fiddles with the peg, fiddles with the clothes, you know, you get pads that end up being off, and it's not that the question that arises is, you know, is this something that the person is doing intentionally? You know, sometimes it gets referred to us as this patient is smearing. Now, smearing carries, you know, the implication that it's intentional, you know, that somebody is deliberately doing that, whereas more frequently, you know, if the patient is, you know, is sort of minimally conscious state, it's simply, roving hands are encountering what